Next question. What the order for delivering the cast crown? What is the order for delivering a cast crown? Answer: internal contact, marginal integrity, occlusion. Again, what is the order for delivering a cast crown? Internal contact, marginal integrity, occlusion. Next question. What's the common cause for porosity in porcelain? Answer: inadequate condensation. What is the cause for porosity in porcelain? Inadequate condensation. Next, repeated fracture of the metal framework. Why? Because of a poor framework design. Poor framework design will cause repeated fractures of metal framework. Next, what does fluoride do? Causes the pit and fissures to coalesce. Next question. Patient who swallowed a crown, you took an x-ray. Where is the crown most likely located? Right bronchi. Right bronchi. Are you sure about that? Let's see. Right bronchi. Let's see the bronchi tree. Yeah, right bronchi, because the left bronchi is is not as um, because of the location of the heart, the left bronchi moves a little more uh, parallel to the surface of the floor. The right bronchi goes down more steep. So you swallow a crown, the most probable place where it will be in the right bronchi. Next, most common cause of amalgam failure: moisture contamination. Most common cause of amalgam failure: moisture contamination. Next, allergy to crown is most likely due to allergy to nickel. Allergy to crowns, most likely due to allergy to nickel. What can base alloys be used for long span? Storyline about a guy who only had four anterior teeth remaining and was completely edentulous in the maxilla. How will the mandible look? The crowns appear longer, and because they're super erupted. Contraindications to use of nitrous: psychosis. What's the effect if you give diazepam to the elderly? In older patients, the drug greatly increases the risk of falls, broken bones, and confusion. It can also cause dependence and withdrawal syndromes. Next, what is not part of the five code of ethics? What is not part? Competency. The five code of ethics. Not which one is not part of the 5 code of ethics? It will be competency. That is not part of the code of ethics. Next, what's the hematologic malignancy that affects plasma cells? Multiple myeloma. Hematologic malignancy that affects plasma cells. Multiple myeloma. What do you see in myocardial infarction but not in angina? What do you see in myocardial infarction but not in angina? Thrombosis. Next, patient who took oxycodone and developed hypotension and itching. Why? It's a side effect of histamine. Histamine, hypotension, and itching. Histamine. Patient who took oxycodone and developed hypotension and itching. Why? Histamine. Next. Place the denture in the mouth and then experience temporary salivation due to parasympathetics. Place the denture in the mouth and then experience temporary salivation due to parasympathetics. Next, patient satisfaction with dentures. Cultural definition of aesthetics. Cultural definition of aesthetics. Which dog wouldn't raise a concern for greater problems? Next, which isn't the line of drugs for angina? Beta blockers. Which isn't in the line of drugs for angina? Beta blockers. The drugs that are going to be nitrates and calcium channel blockers, but not beta blockers. Beta blockers have to do with lungs, have to do with blood vessels, etc., but not for treatment of angina. What would be a concern for someone who is on vasodilator and also taking drugs for erectile dysfunction? Hypotension. Someone using a vasodilator and also taking drugs for erectile dysfunction? Hypotension. Next, how long after doing an aesthetic gingivectomy do you have to wait before you can do general restorative work? 3 to 5 weeks. How long after doing an aesthetic gingivectomy do you have to wait before you can do general restorative work? 3 to 5 weeks. So this is a two-part question. The epithelium of a free autogenous gingival autograft undergoes degeneration at the recipient site. That is true. And the genetic info to the nature of the epithelium overlying the connective tissue is contained within the graft connective tissue. True. Both are true. Again, epithelium of a free autogenous gingival graft undergoes degeneration at the recipient site. True. Genetic info to the nature of the epithelium overlying the connective tissue is contained within the graft connective tissue. True.